Blog Talk Radio.
We are the UR Tennis Network. Our mission is to be the voice of tennis. We enlist a team of passionate enthusiasts to promote our sport. We strive to bring interesting perspectives on the many spins of tennis. Our goal is to provide the learners of our sport with current news and information from many angles. We seek active participation from communities interested in tennis, but tennis is not interested in them. We are expanding our outreach. Tennis is a true lifetime sport that needs to be talked about, and the UR Tennis Network pledges to pursue this idea relentlessly.
Good evening and welcome to the Parenting Aces radio show on Blog Talk Radio's UR Tennis Network. I'm your host, Lisa Stone, and I apologize for the delayed airing today. I have been at a tournament with my son, and the tournament was plagued with rain delays all 3 days. I'm happy to say we are finally finished. He and his doubles partner actually won the boys' 18s doubles, so that was pretty awesome. And a nice finish to a crazy weekend. But again, my apologies for the delay in airing the show today. I had no internet access where I was. So I am now back in the comfort of my own office and sitting at my desk and coming to y'all live from Marietta, Georgia. So thanks for tuning in, and I hope you enjoyed today's show. I did pre-record the interview with Dr. James Andrews, and you're in for a real treat. He shared some fantastic information with me on sports injuries in junior athletes and what we as parents and coaches can do to help prevent them and how best to treat them when they do occur. So before I play that, though, I want to just mention to you, and this comes up in the interview, Dr. Andrews does have a new book out. It's called Any Given Monday, Sports Injuries and How to Prevent Them. And I just finished reading the book and added a link to it on the books page on ParentingAces.com. I highly recommend that you all read it. It's a very, very quick read, but chock full of some great information that we all need to have at our fingertips, all of us parents and coaches as well. And a funny story, when I started reading the book, the beginning of the book, Dr. Andrews talks about his background and how he got into medicine and sports medicine specifically and orthopedics. And as I'm reading it, and he's talking about where he grew up in Louisiana, which is where I'm from, then he talks about where he went to college, which was Tulane University, which is where my dad, who's also an orthopedist, went to college. And then Dr. Andrews talks about his years in medical school at LSU Medical School, which, again, is where my dad went to medical school. So I started connecting the dots and made a phone call to my dad, and it turns out that the two of them know each other very well. And it's just such a small world, reading this book and then talking to Dr. Andrews on the phone and realizing that he and my parents have known each other for years. So it's kind of a cool association. So anyway, I want to also mention to you guys that after speaking with Dr. Andrews, I looked into the organizations that he'll talk about in the interview, specifically the StopSportsInjuries.org, and I went to their website and saw that I could be a partner organization with them, which I have become. I applied for that and was approved. And so you'll see on the bottom of every page on ParentingAces.com their logo, and next to that a place to click to take the parent pledge to have safer sports environments for our children. So I hope all of you will take a peek at that and click on the link and digitally sign that pledge so that we can make sure that we're keeping our kids safe out there on the court and also during practices. It's very important that they stay safe then as well. So before I click on the interview with Dr. Andrews, I want to just take a quick break and go to our American Tennis Hall of Fame Minute. This week's American Tennis Hall of Fame Minute remembers one of the greatest American women ever to play the game, Alice Marble of San Francisco, California, winner of 18 Grand Slam titles, 5 in singles, 6 in women's doubles, and 7 in mixed doubles. Alice overcame many hurdles in her life, including being raped at the age of 15, and she suffered from both pleurisy and tuberculosis. While many know Alice as the first woman to serve in volley, the women who played against her always considered her a friend and confidant, none more so than Althea Gibson, because Alice took a public stance in support of allowing Althea Gibson to compete. Marble was the Associated Press Athlete of the Year in 1939 and 1940. After capping a stellar amateur career in 1940, Marble turned professional and earned a great sum of money traveling around playing exhibition tournaments. Through illness and victory, Marble had the support of her coach and mentor, Eleanor Teach Tennant, who changed her technique and influenced her life. Tennant also coached Maureen Connolly and Bobby Riggs. For a brief time after retirement, Marble worked on the editorial advisory board of DC Comics and was credited as an associate editor on Wonder Woman. She created the Wonder Women of History feature for the comics, which told the stories of prominent women of history in comic form. During World War II, Marble was married to Joe Crowley, a pilot, who was killed in action over Germany. Only days before his death, she miscarried their child following a car accident. After an attempt to kill herself, she recuperated, and in 1945 agreed to spy for U.S. intelligence. Her mission involved renewing contact with a former lover, a Swiss banker, and obtaining Nazi financial data. The operation ended when a Nazi agent shot her in the back, but she was extracted and recovered. Few details of the operation ever emerged. This has been our American Tennis Hall of Fame Minute. And now here is my interview with Dr. James Andrews. Enjoy.
Blog Talk Radio.
We are the UR Tennis Network. We are the
I am here with Dr. James Andrews. And Dr. Andrews, thank you so much for taking time out of your busy schedule to talk with us today. Are you with us?
Thank you, Lisa.
Great. Thank you so much for being here. Your new book, Any Given Monday, Sports Injuries and How to Prevent Them, really hit a nerve for me as the mom of an 18-year-old competitive tennis player and as a person who is around competitive athletes all the time and seeing injury after injury in these young athletes, and it just breaks my heart. And so when I saw your book, the link was tweeted, and I picked it up and jumped right in. A lot of what you said resonated with me personally, and also as the writer of a website for the parents of these junior tennis players. Can you tell us briefly what inspired you to actually sit down and put all of this fantastic information into book form?
Well, I came to the realization that as an orthopedic sports medicine doctor, we were remiss in trying to take care of kids from a preventative standpoint. We've had so many advancements in sports medicine over the last 30, 40 years relative to taking care of kids that are hurt, but we have neglected the thought that, gosh, prevention is more important than the actual treatment, particularly having to operate on so many of them. And I began to notice in my sports clinic that my examining rooms were being covered up with young kids, younger and younger, with adult-type sports injuries, particularly to their shoulder, their elbow, and their knee. And we started tracking that through our American Sports Medicine Institute, which is our research and education foundation, in year 2000. And since then, we've noted in some of the individual youth sports a tenfold increase since year 2000 in these sports-type, mostly overuse injuries. So that really prompted me to begin to research what we could do from a preventative standpoint. Now, there are some 29 or so, probably more than that, different youth sports. But they've all had increased injury, and the big factor, of course, that we found out was related to a specialization or year-round participation in a single sport. And one of the ones that really came to the forefront where I was seeing most of my problems was in youth baseball. So that's where I really started with it. It took a long time to get everybody on board, that is the sports doctors, to come to realization that, hey, we've come a long ways relative to surgical intervention and fixing things, but we need to get involved in prevention. And
right.
Indeed, that's sort of what happened. I'll tell you more about how that was initiated as we move on forward into this presentation.
Great. One of the things that jumped out at me in your book was that we need to really trust our kids to tell us when they have pain, and we need to help them understand the difference between what's a good sore and a bad sore in their muscles. So maybe you can give some tips to us, because my audience is mostly made up of parents of young tennis players. Give us some tips on how to understand the difference between, just being regular old sore because you had a good hard workout versus needing to go see a specialist.
Well, kids at a young age, that means, kids that are junior high, grammar school, they don't really have soreness with their particular type of sports events. But when they come in and tell you, which a lot of times they won't tell you, by the way, they certainly won't tell their coach. But when they come in and tell you that they're having pain, you have to pay attention to it, period. And it's difficult to discern how significant it is. But if you take the attitude, well, that's just soreness from working out hard, or it's just a bruise, and go back and participate and don't take any time off to allow that to settle down, you're probably making a mistake. So the younger they are, the more vigilant you should be with them, and the more conservative you should be in telling them, oh, suck it up, no pain, no gain type attitude. So basically a young athlete, I'm talking about in that young age group where they're still developing, perhaps they haven't gone through puberty yet, they should not participate when they have any significant pain at all. And again, that's hard to judge in a young kid, but I think you have to listen to them, and you have to say that's significant, rather than saying, "Oh, go participate." That doesn't mean anything. And the other good thing is if you can't quite figure it out, seek out your local sports medicine physicians, and that may be a primary care doctor, it may be an orthopedist, it may be a pediatrician, and get the kids checked out so that you're doing what's right, and particularly if you don't quite know how to handle the situation. Now, you can't run them to the emergency room every time some little something happens, but if there's question in your mind, sit them down for a day or so. Use ice. Get them to see a physical therapist, chiropractor, sports chiropractor, whatever, and get them evaluated and get some conservative treatment. But don't tell them to don't try to chastise them for not being tough and play with pain, because then they propagate their injury.
Right.
It's not an easy chore, and most parents mean well. There's no question about that. One of the things I've been trying to do in this book was to reach grandparents. Grandparents pay pretty close attention to their grandkids, by the way, and they've been around the horn a little bit more than perhaps the parents. But I've been trying to get grandparents more interested in keeping an eye on their grandkids, because I know from my own standing, I have 6 grandchildren, and I pay a lot more attention to them and the sports they're doing than I did my own kids. I had 6 children, too. But I was pretty, pretty non-aggressive in taking care of my own kids when they were playing sports. So I understand how parents are.
Right.
But grandparents can sometimes be the difference in the decision-making about taking care of these kids. So a lot of things in that book were geared toward trying to get the attention not only of parents, players, coaches, but also grandparents.
Interesting. One statistic that you cited was that 62% of injuries happen during practices, not during competition. And I thought that was, just an incredible statistic.
Well, look at the number of minutes devoted to practice compared to competition. So that's why that happens like that. The big factor in any injury, in any youth sport, is still fatigue. And if you practice them hard to fatigue, the injury rates go way up. Here's another statistic that's important for parents, and this is related to youth baseball, but it could also be related to any youth sport, but particularly to youth baseball. And that is, if you throw a baseball with fatigue, and fatigue could be event fatigue, which means too many pitches in a game. It could be seasonal fatigue, which means too many innings in a season, or it could be year-round fatigue, which means playing year-round youth baseball. If they participate and throw with that any form of fatigue in youth baseball, particularly when they're young, there's a 36 to 1 times. That's 3,600% increase chance that they can injure their throwing shoulder and throwing elbow. So fatigue in youth baseball, as well as any of the youth sports, is a big problem. So parents need to remember that, and taking them to fatigue and overworking them as a young kid, all that does is markedly increase their injury rate. And it can certainly happen in practice.
Sure. You talk a lot in the book about having an emergency action plan, and I know you've started an organization called StopSportsInjuries.org, and I was wondering if you have a few minutes, if you can talk to us about what an emergency action plan needs to entail and how we as parents can be advocates for our children in preventing these types of overuse and fatigue-related injuries.
Yes. Go back to the STOP program so they'll understand that. I told you earlier in this discussion that I would tell you how we got the orthopedic surgeons, the pediatricians, all of the sports doctors involved in prevention, and that was through the STOP program. The STOP is an acronym for Sports Trauma and Overuse Prevention in Youth Sports. So we call it the STOP program. Now you got to realize we're not trying to get the kids to quit participating in sports through this program. So STOP is maybe the wrong connotation. But our motto is to keep them on the playing field and out of the operating room. So you'll understand where we're coming from. When I was president of the American Orthopedic Society of Sports Medicine, 3 years ago now, I'd been working on trying to get our society, and that society is made up of orthopedic sports doctors throughout the 50 states. And I've been trying to get that organization done to try to prevent injuries. And we were able to do that about 3 years ago through this program. And that started at the grassroots levels in local communities with the orthopedic surgeons that are involved in sports medicine, along with a number of other sports organizations, including the Athletic Trainers Association, the pediatricians, the medical sports medicine doctors, the primary care sports medicine doctors, the sports physical therapists, on and on and on, to try to develop at the grassroots level the education situation to try to teach parents what the risk factors are and what their kids are getting into. You know, parents really have, when they come in with a kid having a major injury at a young age, most of them will tell you, I had no idea that my young kid, age 13, could get injured playing this sport. So that's an education program. And then we have a lot of guidelines similar to what you read in my book that are on our website for the Sports Medicine Society. And that, I think that website would be important for me to point out at this point, and it's www.stopsportsinjuries.org, www.stopsportsinjuries.org. And that's constantly being updated relative to tips for parents and grandparents, coaches, and athletes alike. Now, one of the things that we have mentioned not only in my book but also on that website is the need for a emergency action plan, and that is basically the responsibility of parents and the parents' sports booster clubs in junior high or even grammar school, junior high, and particularly at the high school level, to have an organization plan in case they have some type of injury at practice, an injury during the competition, game time injury, practice injury that might occur even on the playground, to where if a kid gets, let's say a kid's playing pickup soccer at PE in school and he has a concussion, what are you going to do? What is the action plan? And that should be posted throughout the school so that the first aid teachers, the school nurse, most schools, public schools, don't have athletic trainers, which is a whole other problem. But whoever's in charge, you should have somebody in charge of that action plan so they know how to call the EMTs. They know where they should take the kid for certain, where's the closest emergency room. And what do you actually do if somebody has a catastrophic injury? Let's say they're at football practice and they have a heat stroke. Well, you should know what your action plan is and how are you going to handle that. And basically, we have always recommended that be in the hands of the parents with the kids that are participating in a particular sport. It might be a club sport. They
Right.
still have to have an action plan as to what do you do in case of various emergencies. And
Right.
parents should be particularly involved in that to make sure that that's constantly updated and it's posted and it's written up and it's worked on by that particular organization, whether it be a club sport or a high school sport or junior high sport or whatever. So that's what we mean by emergency action plan. They should have defibrillators posted and available throughout the school, in the high school gym, for example, in case they had a cardiac arrest in a high school gym or a junior high gym or at any basketball game. And somebody's got to be responsible on a monthly basis so that the defibrillator doesn't have a burnout battery. So somebody's got to keep the thing recharged. I'll give you an example. There was a state that I know of where a high school basketball player had a cardiac arrest on the basketball court. They went and got the defibrillator, but the battery had run out. So you can't let that happen. And again, parents have to take the lead. Don't think that it'll just happen because it's supposed to happen. So I ask parents to get involved with the emergency action plan. And that's to help in case of catastrophic injuries or some type of a major catastrophe on the playing field.
Right. One last thing I want to ask you about, and then I'll let you get back to your busy schedule, is you talk about burnout in the book and how to prevent it, and I know that's a huge issue, especially as kids are approaching the middle part of their high school athletic career. College is on the horizon, and we see it a lot in tennis with kids just tossing in the proverbial towel and giving up on sports altogether. Can you share with us quickly your thoughts on what causes burnout and what we as parents can do to help prevent it?
Well, the major reason for dropout is burnout, or whatever you want to call it, is over training, which can be related to specialization and what we call professionalism, and that means training them when they're young like they're professional athletes. You know, there are some professional athletes that you know, and I'm sure you would know who I'm talking about, that started training in a specialization in one sport when they were real young. You got to remember that those athletes are one in a million, and they're particularly genetically favored to be able to do that. So parents that think they can take their kid and start them and overtrain them as if they were professionals at a young age will either have an overuse injury and drop out because of that, or they'll burn them out. So also the other thing that creates burnout in kids dropping out is coach abuse. And the coaches that push them hard, stay on top of them all the time and push. I hate to use the word abuse because most coaches mean well, but coaches are there to push these kids. But pushing them hard will drive them away from the sport. And that's particularly true in what we call the late bloomers. And the kids that are 12 or 13 years of age, a large percentage of them don't mature as quick as the smaller percentage of the ones that they compete against. So the late bloomers can't quite keep up, and the coach pushes them, or he sits them on the bench, and they wind up losing their interest and drop out. Peer pressure makes them drop out and burn out quick. But late bloomers, by the way, may wind up being your best athletes, and you hate to see them drop out because they're physiologically younger than everybody else they're competing against. And yet when they're 19, they're the best athletes because they were late bloomers and didn't grow up and mature until later on in high school. So, you know, the burnout rate, by the way, in some statistics, there's a 70% burnout rate in youth sports by age 13. Now, that seems high to me. It may seem high to you, but some of the statistics actually will quote that percentage. So the burnout rate is higher than it should be, and the problem is when they quit playing a particular sport, some of them get into trouble, wind up on the street, and then you know what goes on after that.
Right.
So we want to keep them in sports, and if we can prevent the burnout rate and keep them involved in sports through their young years until they catch up to decide really what they can and can't do in sports, then we're all better off. At least I would think so.
I absolutely agree. Thank you so much, Dr. Andrews. I know you're trying to catch a plane, and so I'm going to let you go, but thank you again, and I will be posting the link to your StopSportsInjuries.org website as well as a link to your book for my listeners to take a look.
I think that will help. I'm sorry I can't talk to you longer, but I've got to head to Washington, D.C. to cover the Washington Redskins, and we've got a big game tonight up there against the Seattle Seahawks. So I've headed up there for the football game tonight to take care of the Redskins, and hope we can get through this game.
Yeah, well, good luck to you. Safe travels, and thanks again for being with us.
Thank you for your taking time to point out these very important points and to get this message out to your viewers. And if you want me to talk to you at some other time about some of this situation, I'm passionate about it, and I'll be more than glad to help you and your local listening audience.
Thank you so much. I appreciate that, and I'll definitely be calling on you again.
Take
Thank you.
Care.
All right, you too. Bye-bye.